All right, welcome to the mock interview for the ACF that you're going for. So, for this mock interview simulation, we're going to skip the first question, which will be for you to interpret data for technical and lay audience because your data is not ready. And so, before we go on, my name is Carlo, and I am one of the co-chairs of Estuk Academy. Manu, can you introduce yourself, please?
Yes, Emmanuel, one of the senior management team of Estuk Academy as well.
Okay, can you introduce yourself, Nurola?
Yeah, sure. So thank you for doing this mock with me. My name is Nurullah Khan. I am a doctor working currently as a F2 in the UK and an applicant for one of the interviews in ACF in public health.
All right, thank you very much. So we'll move on to go straight to the interview. That's okay. So the first question here, we'd like to hear about your evidence of academic achievements to date. So please, can you summarize your academic achievements and your personal contribution?
Yeah, so I'll go through the things related to academia that I have done throughout my portfolio or throughout my experience till now. I would say I have a fairly balanced achievements in terms of things like publications, research, degrees, and posters, etc. So from my background, I am a medical doctor. I have also done a Master's of Science in Public Health from Pakistan, and I had a good GPA of 3.73 out of 4. In terms of publications, I have 7 research publications to date. I have worked on 14 researches in total, 7 of which are published and some are under consideration in journals right now. And I am a first author in more than half of those publications. I've also done some presentations. One of them was on a national level. It was based on an outbreak investigation that we did in our country on HIV cases in one of the regions. So I presented that in a national conference, and I've done some local presentations as well. One of them was on the 2022 floods in Pakistan, which caused a lot of devastation. And that was based on a scoping review that I did. So apart from that, I have done quite a lot of research. I have received some certificates of appreciation as well. One of them was from the WHO by contributing to a polio eradication program evaluation. And yeah, I think I have done a lot of courses related to public health research and just clinical in general. I have teaching experience as well. I have taught to students. I have taught to medical students and students from other backgrounds in clinical research and public health topics, and I've received certificates of appreciation from them as well. So I think overall that would give a general idea of my achievements related to academia. There are some other aspects as well, but I will just limit it to those for now.
All right, thank you very much. Moving on to the next question. So we're going to be considering your knowledge of science stroke academic medicine related to the advertised ACF posts. Can you tell us what area of research linked with this ACF post interests you?
Yeah, so just for context, I've been shortlisted for the ACF in Warwick. Warwick, it's going to be in the Warwick Medical School, and the area that I went through the job advertisement, and they had a few different research groups which were doing research in different areas. The one that I was really interested in was the Warwick School for Global Health, which are doing research basically in low and middle income countries. So given my previous experience and interest, I think that is something that really interests me, because I come from a low and middle income country, and I am really interested in doing research in terms of tackling health inequalities. And I think that is something that is really prevalent in those countries as well. There were some other areas in the advertisement as well related to infectious diseases, to obesity. I have interest in those as well. I have some experience related to those also, to infectious diseases, based on one of the job that I did before in my country. But the one that really interests me is the Warwick Global Health, because they're focusing on low and middle income countries, and they are doing research over there related to how to tackle health inequalities. I think that would be the specific one that interests me.
All right, thank you very much. Moving on to the next question. So it's about your experience of research. Can you describe your personal practical experience of research in any form?
Yeah, so as I said before, I have my research experience spans to a period of 3 to 4 years, I would say, after I did my F1 year in my home country. After that, I started my master's in public health, and that's when I got into research. So since then, I have contributed to 14 research projects till now, 7 of which are published already. I'm a first author in most of them. All of these researches span on different study designs and methodologies, including qualitative research, quantitative, cross-sectional. There's mixed methods researches that I've done. I've written, contributed to some editorials as well, systematic review and meta-analysis also. And also one that I'm really passionate about is database research. So some of my publication and research are based on secondary analysis of data. So I would say that I've got to know the different study designs quite well in terms of their limitations and their strong points also. I am aware of the common pitfalls that each has also. And when you're conducting research, I have, in terms of the different responsibilities, I have gone through all of the different steps. Because as I said, I led many of the researches myself as a lead author. And I've gone through from developing the research question all the way to assembling a team, giving them their responsibilities, the data collection, analysis, then a manuscript writing, all the way to submitting to journal and publishing. So I'm aware of all of the different steps. One of my research just got published last week in a reputable journal, PubMed Index journal. So I would say I have gone through the whole cycle of research, and I'm quite aware of the different aspects that might, or the bottlenecks that would hinder me.
All right, thank you very much. Moving on to the next question, and that would be to consider the general broad knowledge of other areas of science or academic medicine. So can you share with us some aspect of academic medicine or clinical medicine or basic research that you have read recently that excited you outside of your immediate area of interest?
Okay, so outside of the immediate area, yeah, there was one research that I read some time ago. It was related to sepsis. So the research studied how to utilize AI or machine learning to diagnose patients in the early stage of sepsis. And I think how it went was that it developed 3 different codes and tested it on publicly available data for patients, and tested to see if they can be used to inform clinical decisions. There are scores which helps us to diagnose patients early, like NEWS score, and some other ones that we use to clinically diagnose patients that are in risk of sepsis, but they were trying to study how to if machine learning or AI can do the job better than that as well. And the results were positive. It showed that they can detect one of the models, the codes that they generated, that it had really good satisfactory results. And I think that interests me as well, because my motto has always been prevention rather than cure. So I would say the same thing, if it helps us to save patients before they get more critical, I think that same agenda can be applied to almost any aspect of health. If it's like, for example, infectious diseases, non-communicable diseases, anything, we can try to use AI and machine learning to help inform our decisions. It might take some time to develop trust on those data and the information that they generate, but I think it's a step in the right direction.
Okay, thank you for your responses so far. So moving on to the next, and that will be thinking about balancing your clinical and academic responsibilities. So what do you see are the challenges to balancing the clinical and academic roles? Give an example of how you have overcome similar career challenges so far. What skills would you need and how will you develop them?
So clinical and academic roles, a lot of people go hand in hand. A lot of people deal with them as well. I think this is a challenge that most of the people may have come across in their life at some point. For me, I would say I have been dealing with it for quite some time now, because I have worked in clinical roles and public health roles, academia roles as well in my previous experience. So for me, I feel like I've always been traveling in two different ships at the same time. It is a bit stressful because there are competing priorities, but I think the skills that you really need to be able to carry them both together is, well, I would say the most important is discipline in terms of prioritizing what to do when. I think consistency and developing a timeline in terms of planning ahead, that I would do this task on this time, this much of my time was going to be dedicated to doing academia research, and time would be for my clinical work. That is really, really essential. Without that, I think it's really difficult to manage both of them together. So from my personal experience, I used to do, as I said, I've done a Master's of Science in Public Health, and that was in a time when I was working in a clinical role as well. So I would work on the weekdays, I would do my clinical job, and my Master's I did from an institution which was based in another city. So I would travel to that city on the weekends, and I had weekend classes over there. So I would take them and then come back. And I've also worked in another role in NIH, in which I was working as a surveillance officer and a research associate part-time on both. So I think I have a lot of experience in managing both of them together.
All right, thank you very much. This is the end of the questions that we have for you. Do you have any question for us before any feedback?
No, I think I'm well set to receive my feedback.
Okay, so I will now pass you over to Emmanuel to give you a brief feedback. Over to you, Emmanuel. Thank you.
Thank you.
Thank you so much. That was a good one. Like, honestly, you have the experience you need to go through this ACF role. I'm just going to hit on some few pointers because we are against time as well. But yes, I would say you have an understanding of how the interview would go, and you have a plan on how to approach the questions. Yes, in terms of for your degree, you made mention about your CGPA. If that was a distinction, as opposed to just saying your CGPA, just say you had a distinction, your master's in public health. You don't really have to say from where you had that. You could just mention you had a Master of Science in public health, finished with a distinction, and yeah. So you could just remove some details, no, because just to save time as well and make it more concise. And you have an extensive research portfolio as well, which is good that you highlighted them. I think it was down in your research experience that you now spoke about how what you've done in terms of you use data analysis, secondary data, delegated, what's it called, responsibilities to your team as well. So it would be good to that question of academic achievement. They talked about your product and what's your project, sorry, and your contributions to them. So it would be good to highlight your contributions as well to the project, even if you said you were the first author, just mentioning what you did. So in your if you knew about the research area, it's good you mentioned you had a conversation with the supervisor. I think you didn't mention that when you were responding, but you did earlier while we were having an informal conversation. So when you're responding, it's good you mentioned that you've had that conversation, and yes, that will really show you're interested. And just try and read about the area, what is happening in the area, how they do their clinics, how they do, okay, this is public health, or what kind of things goes on in the area. Just have an understanding of the structure of the area, just in case they want to go into that. And then for yes.
Yeah, so just quickly adding there, you mentioned that I should mention that I've had a conversation with the supervisor. Would it be like a conflict of interest that I've already had a conversation, or is it totally fine?
No. It's not a conflict of interest at all. In fact, it is required, or it is expected, or it is expected that you should have made contact that you're interested. So it's not a conflict of interest. Instead, it's a positive marker to say you are interested. If he is there, you could as well just acknowledge, I spoke to this person and he was kind enough to tell me more about the project. So yes, just moving fast. For research experience, yes, you have the experience. Mention PPIE, patient and public involvement and engagement. So just find a way to include that in your research experience, that you are aware of PPIE. And even if you've not used it directly in your project, just show awareness of how it's important in research, as research needs to be patient delivered, so patient needs to be carried along. So yeah, I like what you said about you're interested in prevention rather than cure. So it just shows your enthusiasm in public health. Then the last part is on what's it called, how you balance. So there's a B to that question, which is what needs do you have and how you would develop it. So there is this thing to want to just answer the A part of balancing and leaving completely the B part. So ensure you're able to run through and get to that part of what needs do you have and how you can develop it. Yeah, so I will just stop here because of time. Thank you.
Okay, thank you so much for the feedback. Can I just ask a quick couple questions just for my clarification, if that's okay?
All right, go ahead.
So just one of them, in terms of you mentioned that I should specify some of the researches. There's two questions that are a bit like similar. One is related to experience of research and one is your academic achievements. Do we need to mention in any of them, like one of my researches, how I did them, or do we just keep it general?
So you can give a general overview and maybe just pick one, or just say this research was about musculoskeletal disease, or this research was about prevention, and I've presented it in this conference. So you don't have to, of course, you can't give details of the 14 you've done, but just saying one or two of your publication, especially the ones that led to conference presentation. So you could just say what they were about, especially if it's public health related. It's good you highlight it just so they know you have an experience with this.
Okay, and just one more question. How much time should we aim for our answer for each question?
So the interview structure is 30 minutes. The scientific presentation is like 5 minutes, lay audience 3-4 minutes. Each of the other questions, they would roughly give you up to about 3 minutes. So have the details, and sometimes they can stop you, but don't so cut your answers that you leave out so much details and you see by the end of the interview you still have time. So just have details of what to say, and if they cut you, fine, but if not, just 2-3 minutes should be fine.
Okay, thank you so much.
Thank you.
All right, thank you very much, and we wish you all the best in your interview when you do have it, and do update us how it goes. Okay.
Thank you so much, Carlo.
Okay, thank you, Emmanuel, for that wonderful feedback, and have a nice day, everyone.
Have a nice day as well. Thank you.
Yeah, take care. Thank you. Bye.